This material is made available to you by or on behalf of the University of Melbourne under Section 113P of the Copyright Act 1968. It may be subject to copyright. For more information, visit the University Copyright website.
A very warm welcome to all of our participants joining us today for this webinar, which is a partnership between Asialink Business and the World Mosquito Program, focused on showcasing the important work of the World Mosquito Program in our region. Before we commence, I'd like to start by acknowledging the traditional custodians of the lands each of us are meeting from for this online event. I pay my respects to their elders, past, present, and emerging. I also extend a very warm welcome to participants of Aboriginal or Torres Strait Islander background. The World Mosquito Program is a not-for-profit initiative that exists to protect the global community from mosquito-borne diseases. The World Mosquito Program uses safe and natural bacteria called Wolbachia to prevent the transmission of mosquito-borne viral diseases such as dengue, Zika, chikungunya, and yellow fever. The World Mosquito Program currently has 2 regional hubs, an Asia hub in Ho Chi Minh City, Vietnam, and an Oceania hub based at Monash University here in Melbourne, Australia. The program has projects operating in 11 countries, and its Wolbachia carrying mosquitoes have reached 5.3 million people as of June 2020. The objectives of today's event are to raise awareness of the work that the program is doing, especially in Asia, and to create opportunities for each of you as our participants and for your respective organizations to consider potential opportunities to partner with this important work of the World Mosquito Program. I am delighted that we are joined today by Dr. Claudia Surjaya, World Mosquito Program Regional Director, Asia, based in Jakarta, and Mr. Sid Meyer, Chair of Meyer Family Investments, a major supporter of the World Mosquito Program, serving as philanthropic advisor to the program, and of course, the long-standing former chair of the Asialink Group. A very warm welcome to both of our distinguished speakers. I will shortly participate in a conversation with both Claudia and Sid on the important work of the World Mosquito Program. I'd like to highlight that today's session is being recorded. You have the opportunity to ask questions through the Q&A section on your screen. I'd now like to start with a question for Claudia. Welcome, Claudia. Thank you so much for joining us today from Jakarta. Please share with us your views on what inspired you to join this organization and why its work is so important.
Well, thank you, Mukund, and good morning, everyone. It's an interesting question. It's the raison d'etre. So I started as government officer, as a doctor with the Indonesian Ministry of Health, and I work a lot in infectious disease. One of it is malaria. And then I got infected with malaria, also with dengue, and then for 25 years, I've been working in this, and then suddenly the opportunity came with the World Mosquito Program, which is quite interesting innovation using the natural bacteria or Wolbachia. So actually, I already started to prepare my retirement last year. Then this came up, and then this is a combination of research. This is gold standard research, and then advocacy and public health and intervention. So this is all my summary of my professional work came together, and here I am. Maybe this will be my last endeavor in public health professionally, and I want to see as public health worker that we really have something like impactful and meaningful to the public or to the community.
That's terrific. Claudia, thanks for sharing that. Perhaps if you can draw out some of that work and really highlight some of the global public health messages. I know you have some exciting data to share with us today.
Yes, so I have like a couple of slides to show where are we, what are we doing. Well, we currently work in 11 countries, just like Mukund said, and we have 2 hubs and going to be the 3rd hub, which is in Latin America. So that will be in Panama, but due to COVID, it gets paused a bit. And we work in Mexico, Colombia, and Brazil. It's for more than 10 years already. And then Oceania, based in Monash, which is like our first research was there in the lab. And we work in Kiribati, Vanuatu, Fiji, and New Caledonia. And Asia, our hub is in Ho Chi Minh City. We currently work in Laos, Myanmar. These are still the baseline study. And then we do the release in Vietnam, Indonesia, and Sri Lanka. Indonesia is really interesting because we just finished our randomized control trial in Yogyakarta. We started with quasi-experimental study, and the result is remarkable. We managed to reduce dengue incidence by 77%. So this is a gold standard research, and the message is very important that the method is safe and effective and sustainable. So now, since the research conducted and the result is done, we are now aiming to have a public health scaling-wide intervention in Indonesia, also in Asia and Latin America. As we know, next please. Why dengue? So actually the World Mosquito Program, we work not only for dengue, but currently dengue is main focus, but we also work in Zika, chikungunya, and yellow fever, because these 4 diseases transmitted by the same mosquito. So in the world, we have 390 million dengue infections each year, and 40% of the world's populations is at risk of contracting dengue. As part of Zika, we see Zika in 84 countries in the world, and every 4 minutes, a case of chikungunya is confirmed. Now, this is the global. What's in Asia? Next, please. From that 340 million global incidence dengue, 270 million alone is in Asia. And 70%, so we contribute, 70% of the global dengue burden. And 1.4 billion people living in areas at risk of Zika already. Chikungunya, of course, we have a lot of cases in chikungunya throughout the Asia. Thanks to Sid Meier, the other speaker here, and all the supporters. Next, please. So I would like to take this opportunity to thank our collaborators and supporters. Thank you for your believing in us and for keeping supporting us. So why 4 diseases? Because these 4 diseases, they have the same symptoms. And then we have seen that our Wolbachia methods can prevent the transmission of these 4 diseases. Over to you, Mukund.
Thank you, Claudia. Very, very powerful in terms of the footprint that you already have across 11 countries. And we'll unpack that a little bit more over the course of this conversation. And also the scale of the challenge in respect to the 4 diseases and just the significance of Asia in the context of the footprint of the diseases that you're trying to address as well. If I could, build on your comments that have actually asked, obviously 2020, the year of the pandemic, what has the impact of the pandemic been on your work in trying to address these issues with the 4 diseases?
The very core issue with public health is our resources are always limited. And now with COVID pandemic, we have to balance the priorities as well. And the symptoms of COVID actually are very similar to dengue. And this is, we need to have the differential diagnosis, the same fever, the same muscular ache, joint ache, and then nausea or vomiting. And then when I say the resources are limited, that means the health facilities and the health system cannot probably cope with all of this. And linked to that, of course, the health economic. This is already like a current burden of disease. And adding to that is the COVID pandemic, which changed our way of life. Otherwise, we will have this in person, not through Zoom meeting as well. So yes, so it's crucial time. And then we basically for government, this is very challenging. And then again, the health systems. So we need to cope with that, with the current health system. And then, yes, our project get halted several times because when we release the mosquitoes, of course, we have to go to the community. And then when we experience lockdown, everything should stop. Meanwhile, the virus are still there. So it's a mix of challenging time, but we will always manage to do that.
And across the countries in Asia where you're doing your work, obviously the impact of the pandemic has been uneven. It hasn't been exactly the same. Where has your work been most affected this year?
I think it's really relative because in Sri Lanka, we have to pause the mosquitoes release. And then we re-release again after the first lockdown. And now we're under lockdown again and start resuming. And then Myanmar, when we do the baseline study, of course, it's still locked down now. Indonesia, on the other hand, I think we can manage pretty well, even though we still have like cases and COVID cases, but of course we have this health protocols, and then that's why it's an exciting moment actually for us and for me to be here. I'm actually based in Ho Chi Minh City, but with the good news of the announcement of the RCT results, and then the buy-in from the community. This is, I think, the key successful approach. If when the community engage in this, and then they know that we are doing this together. So no public health intervention will be successful without the community acceptance.
That's a critical point, Claudia, and I'd probably come back to that point over the course of this discussion, the approach to actually secure that critical social license to operate and get that community buy-in. Sid, I'd like to bring you into the discussion now. Sid, you're a very well-known philanthropist here and in the region with a number of really critical causes that you and your broader family have supported. Why is it that the work of the World Mosquito Program is so important to you?
Thank you, Mukund, and good afternoon to everyone. Before I answer that, I just wanted to reflect how I've enjoyed listening to Claudia, your comments, and three things struck me. Firstly, we both have in common that we've suffered from dengue fever, in my case twice, and it's no fun, is it? Secondly, listening to you speak, it's clear that dengue and its related cousins are a big problem, and big problems are important and need to be solved, but as a big problem, it may not get the notoriety that other big problems get within our community. And to make that point, if I'm no health expert, and I apologize for the comment, but if someone was to say to me that this year 390 million people were going to contract a disease, I could be tempted to call that a pandemic. And we don't do that, of course, but I could be tempted to call it a pandemic. Look, and thank you for your question. My journey with dengue started when my wife and I and children were living in Malaysia. I did contract dengue fever a couple of times. I'm told by others it would be a good idea not to get it for a third time. And so that was what really drew my attention to it. It was not only myself that contracted it to it, but occasionally some people that worked with me also contracted the disease. It affected them in different ways, depending on the severity of it, and of course depending on their own makeup. But it was that which really was, I suppose, the start to my interest and the start to my, I guess, sympathy with those that have it, and accordingly the topic generally. That journey went into abeyance a little bit when I returned to Australia in the middle of the 90s. But to their credit, Roger and Leslie Gillespie did sufficient homework to find out that I had dengue fever before, and Roger called me some years ago now to inquire as to whether I'd be interested in joining this group at the Monash University to become involved in the organisation that has the capacity to change this big problem for the better around the world. And I said yes to that. I've enjoyed the association with the World Mosquito Program ever since. And I thought then, and I continue to think, that this program has the capacity to make a big hole in a big problem in solving the dengue fever issues around the world. So there's a little bit of personal story in how this came to my life and why I was interested in it, Mokin.
Thanks for sharing that, Sid. So the combination of the time that you spent in Asia, your obviously very unfortunate incidents of dengue fever, and your desire to support initiatives all come together here with the World Mosquito Program. Claudia, can I bring you in here, given Sid's experience, and you spoke about the support that you have from a range of partners. Do you have other partners and supporters like Sid who've had this sort of experience and therefore feel motivated to come and actually support your work?
Yes, that's on my last slide. Actually, we do have a lot of supporters from donor agencies, from Bill and Melinda Gates Foundation, from Australian Aid, IFAD, and then we do have other families, Philanthropies in Indonesia. That's the Yayasan Tahia as well. So this is collective as in public health. We cannot just solve this problem alone. The approach that this is health problem will not win this. This is health problem, but it's also economy problem. It's a social problem. It's everything. So only with the health sector alone, we cannot manage to do this. So again, thank you for believing in us and of the work of the World Mosquito Program. And we actually started in Cairns and Townsville in Australia a long time ago. That was our first research. And up to date, it was, we recently celebrated the 10 years anniversary of that intervention. And up to today, there is no dengue cases in Townsville and Cairns, Australia.
Very powerful and wonderful to hear about the connection and the genesis from here in Australia. Sid, if I could just zoom out a little bit from the World Mosquito Program and ask you a broader question. What motivates you to participate in philanthropic activities more generally?
Thank you, Mukund. I'm not sure I've got a textbook answer for that. I think that, as you know, and some on the call will know, that there's a bit of DNA in our family that rings the philanthropy button. We've all been involved in it pretty much since we've grown up, and our parents have been involved with it. And the modelling of parents is very important in children, and so it was modelled onto myself and others in the family very early on. So I think that's a bit of it. I think the second bit of it is that, as you know, I mean, I think of philanthropy in three contexts: time, talent, and treasure. The treasure bit is, of course, the money bit, but it's the time and talent which I tend to think of as more valuable. Others can judge talent, but in the time component, I mean, I like to give money where I give time, and so does my wife, Fiona. And this is an organisation which gets some of my time, and accordingly, an organisation that gets some of our foundation's funding. And so that's the second reason. And I suppose the third point, and the World Mosquito Program is a is a case in point. It's, I think, very important to believe in the cause or believe in the action. And, this is a matter that's touched me a little personally, as I said before. And as a result of that, there's a personal story and a bit of a personal journey associated with this. And that's not unusual when it comes to the way in which people think about philanthropy, whether it be across arts or humanities or the social sector broadly. There's quite often a personal story behind the way in which people tend to commit their time and their money and their talent in philanthropic pursuits. So I think those will probably be my key reasons, Morgan.
Thank you for sharing, Sid. And of course, at Asialink, we have been a beneficiary of all three elements: the time, the talent, and the treasure, and we're deeply grateful for it. And I'm very keen to hear from you, Claudia, of how you work with partners and advisors like Sid and others who bring a breadth of critical capabilities to an organization like the World Mosquito Program, which goes beyond just funding, which is very, very important. But as Sid has highlighted, where Sid gives his time, he often also then provides a proportional level of some funding from the foundation. So how do you go about actually using the breadth of the capabilities most appropriately of key supporters and advisors?
I think everyone has personal story. It's like Sid get infected, dengue. I joined the World Mosquito Program because I believe that I can do something at least in my life as professional and as human being here. At least we can make the difference. So we do have a philanthropy advisory committee, and it's based in Australia still. And we do have our director of philanthropy who manages this, Enrique Longo. And then so like several categories of our support. Of course, philanthropy is either individual or companies. And then we do have 8 agencies and other government agencies as well. So how do we do that? I think we have to start from the need and the commonality. If we believe that this is important, then that is the start of our collaboration. Because again, there are so many people in the world, and there are so many problems as well: public health, education, poverty, and everything. So we start with the same understanding that we need to do this, that this is important. Not only that, but we share the belief that together we can do something different, and especially about this mosquito-borne disease.
Thank you for sharing that. And I want to acknowledge Enrique Longo as well, who's part of this webinar, not necessarily participating, but whose vision and support has actually ensured that we've been able to bring this webinar together. And Enrique, of course, is a senior leader with the World Mosquito Program, and introduced and connected the World Mosquito Program with the work of Asialink Business through Sid Meyer. So thank you to Enrique as well. Sid, keen to hear from you. Obviously, you like to pursue big opportunities, which sometimes can also come with big challenges. What do you see as the big opportunities and challenges facing the World Mosquito Program?
Thanks, Morgan. I think there are a few challenges. And curiously, the first challenge that comes to mind is the notion of breeding mosquitoes. In order to rid the world of dengue fever, curiously, we have to breed a lot of mosquitoes which don't carry the virus and will breed not to carry the virus. The numbers around breeding mosquitoes for us are extraordinary, and that's a very big challenge to be able to, I guess, scale up, to be able to breed in the various locations which are important, enough mosquitoes to be able to make the difference that we know that they can make. So I think that's a challenge. We occasionally talk about that when we meet, and we think of ourselves as in the mosquito breeding business. It's an unusual place to be, when it comes to ridding the world of dengue fever. But it's hugely important and it's very challenging. Look, and I think another challenge is to continue to work with companies in the regions that are important to encourage them to believe that a dengue-free community is a better place for them to work and to run their businesses. Dengue fever as a disease creates huge uncertainty for companies and makes it very difficult for workforces to work effectively. And convincing corporations that a dengue-free world is going to be better for them, and accordingly seeking their encouragement and their support. And here I don't mean just money, I mean their support within the community in many different ways to encourage communities to become dengue-free is an important challenge. It is a challenge when you rock up to a community that is suffering from dengue fever and say to them, listen, we're going to let 1 million mosquitoes go here. I hope you don't mind, but you'll be better off in 3 months' time, or whatever the appropriate time frame is. Getting that message over is sometimes a challenge, and corporate support in getting that message over, I think would be very important. So the second thing is convincing corporations to get involved, to get supportive. Luckily there's been success in this area, and I particularly call out the Macquarie Bank, who have been very generous in the way in which they've got behind this program. So that's another challenge that I think is important. And of course, the last challenge is continuing to see Monash, as the founder and the birthplace of this wonderful organisation, and the role of Monash needs to be recognised all the time as creating the environment through which the World Mosquito Program has been able to thrive. Not that that's a challenge at all. It's in fact a wonderful part of the association with Monash. But in answer to your question, breeding mosquitoes and engaging with corporations to support our global rollout, I think, is a very important part of the challenges in front of us.
That's very helpful in terms of actually framing some of the major challenges, Sid. And one of the actually questions that's come in from one of our participants is about what private enterprises can actually do to support the work of the World Mosquito Program, and if there's a role for Australian businesses. And it's fantastic to hear about the work of Macquarie Bank in supporting the program. But what would be, a few practical pieces of advice that you and Claudia would like to give to representatives from Australian businesses that are on this webinar to get involved?
Claudia?
I have to agree with you, Sid. If you own companies and your workforce always sick, it's the number of productive days missing. And then it's important for corporations to minimize that. So yes, like I said, this is a work that everyone should do together. The government cannot do this alone. Resources are limited. The health sector cannot do this alone. So yes, private sector is crucial supporter and should play more important roles in this quest to eliminate mosquito-borne disease. And thank you again, Sid, for your support, and Macquarie as well, and the Gillespie.
Look, and Claudia is quite right. The engagement of the private sector is very important. We've all had a little help lately because we've got to know what a pandemic is all about, and we've got to know corporately, how we should respond to it. There's no corporation that doesn't have a COVID plan, a COVID safe plan. There's no reason why in the regions in the world that are affected by dengue, there couldn't be such a thing as the dengue safe plan to create create opportunity within corporations to highlight the significance of dengue, and in so doing, provide ways to support families that work for them to minimise the impact on those corporations. We've got used to having some behaviour changes as a result of the current pandemic, and accordingly leveraging that learning to create some changes in the way in which we think and act about dengue fever within companies is in my mind prime time, and managements and boards would be receptive, or perhaps should be receptive, to that sort of thinking. So I see it, interestingly, they're an opportunity at this particular point in time to highlight and begin some change of attitude around dengue fever and the other related viruses.
Thank you, Sid, and thank you, Claudia. Claudia, I want to pick up on a specific point here, because this is a very crucial part of the discussion, which is actually attracting more private enterprises to participate in your work. It is so clear from your comments and Sid's comments, the impact that having a workforce that is unwell could have on productivity and well-being. What are some of the other issues that you find that actually is competing for attention of the private enterprises you're engaging with that impedes their willingness to get as involved as you'd like? And what do we need to do to really support your messaging to help them become more involved?
Thank you, Mukund. I think what Sid said before is right. Who likes mosquitoes? Yeah, it bites and it's itchy, and it's not only that, it brings disease. So to understand our methodology, that is the number one crucial thing first. And then again, our methodology is quite different with the other methodologies because we do care about ecosystem. So we don't kill the mosquitoes population. We actually still release the mosquitoes, but the good mosquitoes with Wolbachia. So, and we don't do genetically modified mosquitoes, and it's sustainable. So when people say, but Madam, the mosquitoes are still there. Indeed, the mosquitoes are still there. We don't kill the mosquitoes, but they are good mosquitoes. So, Madam, can we still kill the mosquitoes? Yeah, be my guest if you want to slap the mosquitoes because they are annoying. But again, so sustainability is issues here and cost effective because we only need to release one time in a series of release. And then the mosquitoes will breed by themselves there with local mosquitoes, which is, they are still there. And then again, our methodology is not to replace the current government implementation or program. So we still have to do all of those basic things like cleaning, the puddles, water, and everything is still the same. So this is just complementary to that. So I think once we understand the methodology and the benefit of this methodology, first of all, it's safe. And this is what important. It's safe to the human, it's safe to the environment as well. Second is cost effective. And the third one, it's sustainable. Once released and it's done, the mosquitoes can breed by themselves there. And I think that if the companies can, we can have calculation of number of productive days, or we can also have this, like in public health, we have quality or quality adjusted life years. So then we can start together again and believe that this is the most simple method, yet effective.
Claudia, I wanted to pick up on a specific point that you made, which is about it being cost effective. There's a question that's come in with the view that costs related to mosquito-related programs are very expensive and can be a loss to the country. Is there any plan from the government of Indonesia to expand the trial or rollout of Wolbachia, and if so, when?
Well, I was a former Ministry of Health, but now I'm not in the position to talk on behalf of government of Indonesia. But we did report the results of the studies to the Ministry of Health, and then other local health office as well as local governments. And we start having a lot of requests to replicate the intervention in many other parts of Indonesia. But to touch what Sid mentioned, we do need a lot of mosquito eggs. And this is our part of the planning to scale up. We need a facility that we can breed the mosquitoes eggs, the nice mosquitoes, the good mosquitoes. And this is probably also what the corporate sectors can help us with. Because we do need a lot of mosquitoes. And to eliminate dengue, it's not easy. Indonesia is 270 million people. Then we have to cover Asia as well. So this is in our plan to have the mass production facility in Indonesia and other in the region.
That's very helpful perspective. So the scale is the big element there, which can help reduce the cost. Just building on that, again, very keen to hear your views on the impact of the environment when Wolbachia is injected. What have you seen in Indonesia, for instance?
Let me start what we did in Yogyakarta. So in Yogyakarta, like I mentioned, it's actually a study, it's clinical trial. So we started with a small intervention area and control area in Yogyakarta. And then we just finished the results, which is 77%. Then built on that, we want to do the scale up in 5 years. We want to have like 30 million people in Indonesia, and worldwide, we want to do 75 to 100 million people. And 2030, we want to reach 500 million people. So again, it started small, but then we have to replicate. And then when we do that, at the end, the cost will reduce because the mosquitoes are already there. The mosquitoes, they do not need passports to travel, and they will be just there. And then Wolbachia is a natural bacteria. It's already there. It's 70% in insects. It's already there. We just speed it up and make it more cost effective. And then again, when the more we release and the cheaper it will become. Do I answer your question?
Yeah, absolutely. No, absolutely. I think it links back very nicely with Sid's comments, which is, as Sid put it, it is a mosquito breeding business. And I think that as you build scale, what you're saying is that you're able to reduce the costs. I want to pick up on another excellent question that's come in from Andrew Dixon, who's actually based in Indonesia, which is about how do you actually go about, commencing a process within a community? If you can share with us that process, and it links to an earlier point that you made, which is actually getting buy-in from the community, which is really important. So how do you go about that actual process in communities, if you can share some examples, and how can communities actually get started in their respective areas?
So in WMP, we actually developed a PAM or public acceptance model. So this is our strategy how to engage, and first is communicate to the community. And our projects, if we do the release for 3 years project, the first 1 year at least is to communicate with the community. When you come to the community and say like, hey, we're going to release mosquitoes. And they're like, what? Isn't it enough already? Do we need more mosquitoes? So this is the crucial part in all the activities, is to educate the people, to communicate with the people. And once they know, they understand, not only that, they are working with us. The success in Yogyakarta is actually because of the communities. The success in Latin America, the success in Oceania, because the communities work with us. I was there 2 months ago after the announcement, and I attended. I went for the release, so I went to the community with the buckets full of mosquito eggs. And then, to my surprise, the community asked like, hey, can we have more buckets? because my plants, I have a lot of plants, I have a lot of gardens, so one bucket is not enough. So this is really and then actually the people in Yogyakarta in the control area, they request, when is our turn now? You manage the clinical trials, the results, and it's good. So we also want that. So this is something that, yes, the buy-in from the community is crucial, and we work hard to make sure before we release that we have this acceptance, and we do have indicators to measure the acceptance of the community, and also local government, so everyone. And we do work within the health system. We don't set up a separate system, so we work together with the health facilities, with the district health office, and with the community.
That's terrific. I want to ask you one more question on this important issue, just to go even more deeper. That you're in 11 countries at the moment, and there's obviously tremendous diversity within many of these countries. So in terms of how different communities within even any one of these countries might respond, let alone across regions in Asia and the Pacific, in Oceania, and then of course in Latin America as well. Where have you found some of the most receptive communities? And if you can just compare a little bit for us, perhaps Brazil with Vietnam, and Sri Lanka with Mexico, from a cross-cultural perspective, what have been some of the interesting challenges you've had to navigate to get buy-in from these very diverse communities?
Yes, it's diverse, but at the end, it's the same. When we think this is the need, our need, and then it's the same. In Latin America, we work with school children, for example, to release the eggs, and also this is like a science project for them. So it's also early education on science for them. And in Sri Lanka, we work with women. And then in Indonesia, we're also planning to work with disabled people, and also, so this is, again, it's all together. Yes, it's diverse, but when the community is there, and community consists of many, many different people. And then again, we start from the commonality, and then that's why and actually it's very interesting, because in each side, we managed to collaborate with different entities, different organizations, different individuals. But at the end, again, the aim is the same. We want to eliminate the mosquito-borne disease, and specifically dengue.
That's very interesting. Sid, I'm going to bring you into the discussion here. Very keen to hear your views about those that are not in decision-making roles within corporates. So those in middle management, for instance, how can we get them more involved with the work of the World Mosquito Program? And what would you be saying to them as advice to become more involved, and then to go back and advocate to their senior leaders on supporting the cause of the World Mosquito Program?
Well, Mukund, I think a couple of things. Firstly, I'd be encouraging them to Google World Mosquito Program and to learn as much as they can about actually what the program is. The second thing would be to keep statistics on the number of people that don't show up to work because they have dengue fever. And I think you'd find those statistics in certain parts of the world would be quite astonishing, potentially alarming. There's nothing like statistics to be able to tell the story, and it's that story which more senior management, I think, has the capacity to listen to. So, statistics about absenteeism and people not arriving at work is a very powerful story for middle management, who find it hard to call in replacements to a warehouse or to a factory, whose productivity may not be quite as they would like. They may not be meeting their KPIs or other such metrics. The real world statistics of dengue in particular parts, I think, is the key thing that middle management is able to bring to the table to help influence companies that there's an issue here and that these companies can make a difference. At the extremely practical level, I think that's perhaps one way of doing it, Mukund.
Mokon, can I add to that?
Please.
Well, the absenteeism it will be more difficult when it's women, because women needs to take care of the children.
Yep.
And then when the husband is sick, and then also when the woman is sick. So the cost is not by individual, but the cost is more for the family as well with this, non-productive days.
Great point. Thank you.
Yeah, that's an absolutely critical point, and it links very nicely to a question that we've had coming from Leslie Gillespie, which is how important is government support when starting in a new country? And Claudia, I want to really hear your views here, and if you can compare and contrast government policies, also sub-regional or provincial level policies to support. Where does it come from typically? Does it come through policy intent? Does it come from pressure from the community? Does it come from pressure from business because of absenteeism? What are the factors?
Thank you, Leslie. Leslie Gillespie. The Gillespies is also one of our supporters. Thank you. Yes, government support is of course important, but in our experience, it has not always started with the government. It can start from the community actually, and also from business sector. We do have requests from one province when a lot of companies there. But again, government support is always important. We can never work in a country with no government support at all. So that's number one in terms of regulatory approval, because of course we do have to produce the mosquitoes, and we have to release the mosquitoes. But the requests can be from different sectors, different entities. It can be from community, can be from company, can be from even local government, and can be from national government as well. It is important. Why? It's important, the support, because again, we only want to release one time, then it's sustainable. And then we do not want as a project base. This is a program, not a project. And we want the country to own the program. And then when we finish with the first release, then the country can do it by themselves. So it's no longer, that's our aim actually as World Mosquito Program. This is not a project at all. So that's why government buy-in is also important to make it sustainable.
If I may, Mukan, I think what you said is very interesting. And if companies can adopt the same language, it's not a project, it's a program. The capacity to have a positive impact is much greater. Projects tend to be one-off, but this is a program, and it will take a program to change a lot of the community issues here. So the same rhetoric applies to companies as it does governments.
And Sid, if I could also pick up on that question in the context of your role as a philanthropic advisor, there's a lot of literature on the signaling effect that philanthropy sends governments on what's important and should be supported. And quite often also philanthropy can also receive signals from government as well on what is important and should be supported and needs greater scale. How do you see the role of government as a philanthropic advisor when you look at the work of the World Mosquito Program in the region?
One of the things that philanthropy has the capacity to do, slightly more than governments, is to take risks. Others have heard me say that philanthropy is the venture capital arm of the social sector. And the capacity of philanthropy to take risks with the World Mosquito Program is an important part of getting programs into different parts of the world. It is not risk-free to enter new communities and to be able to have or create the impact that we would like to create. There is a role for philanthropy in taking some of those risks, but you're quite right. Most governments like partnering with others, and particularly philanthropy, where there's the ability to share some of that risk, and leveraging government support and, for that matter, corporate support, using philanthropy to do so is an important part of what philanthropy can bring to the table. The other thing that philanthropy can bring to the table, which is sometimes not quite as evident or not quite as measurable, but it's the simple act of enthusiasm, being enthusiastic, being turned on by this opportunity is, I think, an important role that a philanthropist is able to sort of bring to bear. You can't beat a bit of enthusiasm around the place to sort of have an impact on highlighting the opportunity here, understanding the risks certainly, but I wouldn't underestimate the enthusiasm that philanthropy generally as a sector can bring to projects and opportunities.
That's very powerful, Sid. And Claudia, if I can request for your views on this, of how you actually use the breadth of the partners and the stakeholders you have to impress sometimes upon government about why some of your partners are leading in the discussion and therefore sending a signal to government. If you can share some examples of where, if that's actually played out for you.
Difficult question. I am neither government, neither from corporate sector. But yes, again, like our work with Philosophy and with Sid Meier's, and then also with Tahia Foundations, it's all government. Sometimes they need some hope, I have to say, or nuts a bit. And yes, this is difficult. This is costly at the beginning, but with the help of corporate sectors and communities, then we can do this. And then pushing a bit from like corporate sectors will help. And then in Vietnam also we collaborate with several companies as well, because again, it's where the company is located. It is not only the workers of the companies, but also the people live nearby the factories. It's all who's also affected. And then again, this is a go to the economy and everything. So it's the whole thing. It's comprehensive, the whole thing. And when we tackle something big like this, we cannot do it alone.
And that's very, very powerful in the need for all sectors to come together and all the biggest players in each of the sectors to come together. I'm very keen before we finish to hear about what's next in order to ensure global impact through the work of the World Mosquito Program. There are clearly more countries and regions that require your important work. So what is the next frontier for the World Mosquito Program?
Our aim, we will reach 75 million to 100 million in 5 years. And then in 2030 is 500 million. This is quite modest, actually. We need to reach more than this. But so we are fighting with the time here. We're competing with time, because otherwise there are too many mosquitoes over there. And then we will not manage to do this. So our next aim is to build the production facilities regional in the region to manage to fit with the need, because otherwise we cannot even cover 75 million people if we do not have enough eggs and mosquitoes. So this is the thing that I'm currently also here to do the scoping of the possibilities where it should be located in the region, and this is part of our global strategy.
And very keen to hear from you, Claudia, just on that point, on a couple of key countries that, unless I missed it from your list of 11, India and China, where there is also perhaps a great need for your work. Where do they fit into your plans?
Yeah, India is of course big market, and then we are keen to work in India. It's also in the plan currently, but we've been discussing with the India government. And China, not many dengue in China actually. And then so China is, even though it's the biggest population, but of course to reach the target, we need to work in a like high density populations first. It's dengue is totally different with malaria. It's urban problem. on a high density population, and of course, we focus on the most needed part of the world.
That's
And in Asia, it's where contribute to 70% of the burden of disease.
yes. No, you're certainly focusing on the region that it appears where the need is the most. I am conscious of time, but keen for both of you to have a final word for our participants. If you could leave our participants with one key message of how they can become involved, perhaps one or two key things that they can do to become involved practically. Claudia, if you can share your views first, please.
Well, thank you for this opportunity, and thank you for all the supports from all our collaborators and supporters. Just check our website. We actually also launched a bit of pay it forward program several months ago. And this is actually stem from Cairns and Townsville, when people or community now with free of dengue, they start thinking and contribute a small amount of money just to pay it forward, because they want to see the other part of the world also dengue free, like in their hometown. So check our website. It doesn't have to be money, of course. There are many other things that people can contribute just to spread that our methodology and our work. That's one, and support us in other things. Just spread the news first, because if you do not know, then you cannot help. So we need to know first, what is this World Mosquito Program, and how can we together eliminate this mosquitoes-borne disease?
Thank you, Claudia. Sid?
Thanks, Mukunda. Again, yes, what a pleasure to be with you today. And Claudia, thank you for all your comments. It's been great listening to you. Mukunda, two things perhaps for me. Firstly, to say, start talking about dengue fever within your organizations, within your communities, within your hospitals, within the health system. The more one talks about it, the more the awareness grows, and growing awareness is a critical mission for the World Mosquito Program, hence events like today. So I think talking about it is very important. Perhaps the second thing is to, as Claudia said, jump on the website and through that introduce yourself to Enrica and think about ways in which you might be able to make a difference to the World Mosquito Program. I mean, those are two, I hope, practical suggestions as to how one might be able to get involved and help. Perhaps if there's one other, it's the takeaway that there is an organization which is trying to rid the world of dengue fever, and it is the World Mosquito Program. And if it's successful, the impact in the areas where dengue is alive and well will be very significant for those communities, those businesses, and those governments.
Sid and Claudia, that's very powerful. Some very practical actions for our participants to take away. I am conscious of time, so I'd like to start by thanking you, Claudia, for joining us today from Jakarta and for sharing with us the very powerful work that you are leading in the region for the World Mosquito Program. Your views in particular on the use of your public acceptance model to bring community buy-in was very, very powerful, as were your comments that ultimately this is a program and not a project. And so for the corporate sector in particular, the impact on productivity on their workforce through absenteeism makes this a really compelling issue for corporates, in addition to, of course, the community sector and governments to be involved with. So thank you for those very powerful messages, Claudia. Sid, thank you, as always, for sharing with us your model for becoming involved through the application of time, talent, and treasure, as you put it, and also for reminding us how philanthropy is the VCR of the social sector and the critical role that it plays, and also your articulation of the challenges that the program faces and how it's going about addressing it, from it effectively, in your view, being a mosquito breeding business, the need for the business community to take the lead of organizations like Macquarie to become more involved, And also I need to acknowledge the important role that great universities like Monash in this instance has played to tackle a major global and regional challenge. So thank you, Sid, for bringing out those key messages. And then finally, thank you to all of you in attendance today for your interest in the work of the World Mosquito Program. I encourage all of you to take the advices Sid and Claudia and to visit the website of the World Mosquito Program. This webinar will also be made available on demand. So if you'd like to share it with those that you believe would benefit from listening to the key messages, it would be terrific. And encourage you to stay connected with Claudia, with Sid, and with Enrica Longo, who can be reached at the World Mosquito Program as well. And we'll ensure that in our follow-up message to each of you, we include some of the contact details of some of these key people so you can take the conversation forward. With that, if I could request those of you in attendance to also complete the survey that will be available immediately after this event, because your feedback is always greatly appreciated. That would be absolutely terrific. With that, I'd like to formally close this session and once again thank Claudia and Sid and the World Mosquito Program and all of you in attendance today for your interest on this critical issue. Thank you.